And among the last of our panelists, not the least, is Angie Garling from the Low Income Investment Fund. Welcome to the committee.
Great, thank you for having me. I'm Angie with LIIF. We are a community development financial institution. We finance and provide technical assistance to build housing and build and improve childcare and early learning facilities. And sometimes we do them together on the same location. And during the pandemic, we responded by providing over 1,700 grants worth over $28 million to family childcare providers and some centers, and helped operators apply for the payroll protection program. And we've been working in this space as a financial institution, invested in early care education for over 20 years. And I'm here today to talk about the importance of the physical space component of childcare services. Facilities are often considered the third teacher. So not just the teacher, not just peers, but the environment helps support children and provide critical play and learning spaces, as well as health and safety factors like ventilation and shade. And it also provides a critical workplace benefit for the early childhood educators, because it's important for them to have a great place to work, as well as a great wage. And as our previous speakers have said, there is a well-documented childcare supply crisis before the pandemic. The pandemic exacerbated it with thousands of closures. And just one data point, in this state, less than 10% of eligible infants and toddlers actually receive subsidized childcare. So the need is staggering. It's in the hundreds of thousands. And we need not just workforce infrastructure to ensure that we have the best teachers and educators and providers, but we also need facility and physical infrastructure. And so we appreciate the Senate's commitment to new spaces, and facilities should be an important part of that. And so what kinds of investments are needed? Facilities. It's a critical piece of infrastructure. We believe it is just as essential as roads and bridges for families to be able to get to work. And the barrier is that there is currently no money allocated at the state or federal level specifically for childcare facilities. And providers don't plan for new or improved facilities unless they know that there's funding. So it could take time to develop a pipeline of projects when facilities are funded, and we recommend that they be funded. And the facilities funding must include centers as well as family childcare programs, because we need to ensure adequate parent choice. So we need a balance of home-based and center-based options. For example, at LIIF, we have 3 products that help support family childcare providers: startup grants, expansion grants, and repair and renovation grants. So these kinds of products should be available as well as facilities funding for centers. So what are family childcare providers and other providers spending their money on? So during the pandemic, they did things like enclose their patio for better ventilation, $6,000. Converted backyard space to move their program outside, $7,500. Replacing appliances like washers and dryers that went kaput because of increased use during the pandemic. And then also the very important ventilation costs. And these are just the ones to get programs back on their feet, to open and ensure that they're providing quality services during this pandemic with increased social distancing. So we will need additional facilities funding to build and renovate space. As an example, we often allocate or think of $500 per square foot for a center that could serve 100 children. But we also just financed a center in San Francisco that was a standalone center that actually cost $750 per square foot. So this is not a cheap endeavor. We definitely need funding to ensure facilities. So we're currently recommending a minimum of $350 million for restoration of the existing fund that was zeroed out during the pandemic. And based on some cost modeling we've been doing with UC Berkeley, the true cost to meet the unmet facilities need is actually closer to tens of billions of dollars. So this is a great initial request. Facilities are a great use of one-time money. And federal money is actually an allowable expenditure with some of the stimulus funding, and more federal facilities funding is proposed, but this is not enough. We need to help ensure that we have state money, federal money, and local money. LIIF co-authored a brief that helped states understand how federal stimulus money could be used for facilities, but we believe this is just part of the solution. And intermediaries like CDFIs can help leverage public funding and package financing. So the public funding is only part of the solution. And this is important in order to make federal and state dollars go further. So thank you for your time. And we hope as you move forward, you include facilities funding as one key component of your overall chapter.